My name is Tyson Wendo. I'm a medical laboratory technologist at Texas Cancer Center. So in our lab, we have been classified as Class E in a level 4 hospital. So we do a variety of tests ranging from routine laboratory tests, hematology, biochemistry, immunoassays, blood transfusion, biopsies, and the other histopathology aspects. So majorly here, the major routine tests that we normally run for patients, especially who are on active chemotherapy, is total blood count. That's a full hemogram. We're basically checking for the blood levels in terms of hemoglobin, platelets, and even immunity. If there are any corrective measures, we normally take the measures before the patient is subjected to chemotherapy and radiotherapy. We also check, we monitor the kidney function tests, the urea and creatinine, on every visit before they are given chemotherapy, because the kidneys are the major organs that excrete most of those drugs. So we need to monitor them to continue checking if they are okay, so that they can continue with their treatment. Then for patients who just walk in and they have no diagnosis yet, we also have a histopathology unit where we take biopsies or even the screening tests in terms of the immunoassays. We do the tests like total prostate specific antigen, the tumor markers, CES, CA19-9, 15-3, and the rest. We also have a blood transfusion unit where we welcome donors in. They donate bloods that help our patients, because most of the cancer patients, they have issues with the low hemoglobin levels, so we need to be boosting the blood. So in that unit, we also do the screening here, the donation here, screening plus transfusion. All of them are done in-house. Then the other services that we offer here, there are other tests that maybe the patient might be a cancer patient, but has also other underlying conditions like diabetes, which their tests are quite different, like the HbA1c. We also run those tests because those patients are normally treated as we are treating cancer. We are also managing other conditions that are within the same patient. Thank you.
Mm-hmm. How do you monitor the kidneys?
So there is a machine, it's called a biochemistry analyzer. It uses a principle called spectrophotometry. So it's a fully automated machine. You just put in the sample, you program, then it gives you the results. Then you post, the doctor can access them from the other side. Yes.
And from my understanding, I understand that you usually separate blood and plasma and other things. You can explain on that.
Yeah, so for blood transfusion services, different patients have different needs. For example, a patient might be only having issues with hemoglobin. So that patient only needs the type of product called packed red blood cells. And maybe another patient has a problem with platelets. We only need to transfuse platelets. And another patient maybe, yes, is having issues with the platelet, but also has some other hematological issues. We transfuse fresh frozen plasma. In this case, so once we collect the unit of blood, the whole blood from the donor, we can separate it into different components. The platelets, we can also get the packed red blood cells and transfuse to the patient according to their needs. So the machine that does the separation of the platelets from the whole blood, we have it on site here, so that we can harvest both of them. Then we also have a blood bank which stores all those products, depending on the different conditions each of them has been recommended.
I know most viewers are asking, how do you separate it and it's in blood form, liquid form?
Yeah, so blood, the different cells that are inside the blood and components, they have different density. So we take the advantage of centrifugation. So we separate them using centrifuge. It's a large centrifuge, that one. It's a large centrifuge that when you put the whole blood and you centrifuge for like 45 minutes at a very high speed of up to 2,200 revolutions per minute, we can now obtain the different blood products. We can get them, then we just separate them into a different bag. Yes. So transfusion, majorly in the lab, what we do is donation. We screen the blood then we cross-match. Cross-match is trying to do the compatibility between the patient and the donor. We see if it's compatible. Once the blood has been confirmed that it's compatible, there's a national register that we normally record the details of the patient, where we can track the unit. Then there is a nurse who is always assigned to transfuse the patient. It's normally just transfused normally intravenous like any other fluids and drugs. Yeah, so that work is done by nurses. Yeah, if a patient needs blood and plasma, you cannot give whole blood. It depends on the request. If the request is requesting packed red blood cells and the fresh frozen plasma, you have to give them separate. But most of the time, normally fresh frozen plasma or platelets are the ones that are transfused fast because they take shorter time. Because for you to transfuse blood, you need up to 4 hours. And the platelets may be 20 minutes. Yeah, so you have to start with this one that you finish fast. Then the longer hours you transfuse later. Yeah, for donors, to qualify the donors, first we look at age. Age matters. For here, we normally take between the age of 17 to 45 for ladies, then up to 50 for men. Then the other thing, there is a questionnaire and a consent form that the donor normally fills in. Then it has some assessment questions. Maybe, for example, it's asking, do you have any other underlying condition? If you have it, you will declare it in the form, maybe diabetes. So if a person is having any underlying condition, that person is disqualified from donating. Then the other thing, we take a sample to check the hemoglobin levels of the donor, because there is a minimum which we need. You cannot tell somebody to donate if that person maybe is also a candidate for transfusion. Yeah. Then we also check blood pressure. Yeah,
why the difference for ladies 17 to 45 and for men up to 50?
Generally, men are stronger, so that is the age difference. Yeah. Then for ladies, the ladies who are on periods are not allowed to donate blood, or those who are pregnant, or those who are breastfeeding. Yeah, the reason why you cannot donate blood when you are on periods is because you're already having a wound. And donating blood is taking some blood from you with the platelets. And platelets, they play a very crucial role in clotting. So that wound might not heal fast. So we just advise such donors to give them at least 1 week. Then they come again to donate.
Are there some challenges you usually face in your field?
The major challenge that we face in the laboratory, especially at Texas Cancer Center, is the issue of blood products availability. Because the general public, I feel like they are not well sensitized about how important these products are and how scarce they are. Because we are having so many patients vis-a-vis donors. Because you might even get one patient needs up to 8 products. That means like 8 donors. And you don't have all of them. And this patient may be coming maybe from Mombasa or Busia. That's very far. And they have only come with a relative who has not even qualified to donate. So it's just the availability of the blood products. Yeah, that's the major challenge here. 1 pint of blood is normally equivalent to 473 ml. That is the standard for person to donate. Yes.
How frequent can a person donate blood?
For female donors, they can donate after 4 months, then male donors 3 months.
What are some of the positive things you find in Texas lab?
1, some people have been able to learn through here. We have some students who normally get attached here. They learn so much here because our lab is specialized, because it's in a special facility. It's not like any other general lab outside there. So the student experience here is different. The other benefits that our clients get from us is, like donors, they get free screening of their blood. So people are able to even know if they have blood pressure through donation. So this is where even the diagnosis starts from. Somebody realizes, oh, I even have diabetes. I've been having hepatitis B. So they start treatment to manage it, or even to some extent HIV. So some people have been able to learn of their diagnosis through this lab. Yes.
What can you tell our viewers who are watching right now
Yes.
and they can donate blood?
Yes. The Texas Cancer Center Laboratory is open to the public for blood donation. They can walk in and support our patients. They are really in need of blood donation, blood products, and there is a serious shortage. So we just encourage them, if you're a man, just be passing by. After 3 months, you come donate. It also comes with benefits, because after you donate blood, it's like you're trying to make your bone marrow active and in good state, so there is that replenishing, because the life cycle of the blood is normally, red blood cells normally 90 to 120 days. That is why the 3 months and 4 months. So you are helping your body to replenish the bone marrow.
Is blood donation
free?
Can someone just walk in and donate, or there is a process?
Yes, blood donation is free. We don't charge our donors for anything, but they get a lot of benefits. Like we are able to give them the screening results, which if you are to go outside there and then you just want to screen for the same diseases, you might end up even spending up to 20,000. Yes, and we just give them those results.
Don't forget to subscribe, like this video, and share it with your friends and family. Together, let's tell stories that make a difference.